Hi everybody, my name is Janelle. Today is January 17th, 2013. This is basically a pregnancy diary. Basically, the reason I'm doing this is because I have issues with infertility because of PCOS and endometriosis. And I want to document everything. Me and my fiance are trying to get pregnant, and the reason why we're trying before we get married is because ever since I was 17, I was told that it would be very hard for me to get pregnant. So this segment is going to actually be a pretty long one because I'm going to go through my history and up until the point that we're at now. First, I want to give a history of my background, which is I am 24 now, and I was first diagnosed when I was 17. And I went to the doctors when I was probably 15, and I was telling him that I had pains in my lower pelvic area. And he said that there was nothing wrong, but he would do an ultrasound. So he did the ultrasound, and I never heard back from them. And then I called him again the next year. I told him, and there was something wrong. So he did another ultrasound, and I called them a week later, and they said everything looked fine. So by the time I was 17, I was still having the issues and was still being told there was nothing wrong with me. So at this, I want to tell you to make sure that you have a very good doctor, because I didn't. I've now had 4 doctors, and it's not been a pleasant experience, but I now have a doctor that I love and I trust, and she's great. She is, really. I know I say I'm a lot sorry. Okay, so back to my story. When I was 17, I went back to him and I explained to him, I said, there's something wrong. You need to do something. So he did a laparoscope. Sorry, I can't say that very well. But so it turns out that I was diagnosed with PCOS, which is, for you people who don't know, is polycystic ovarian syndrome. It basically means that my ovaries are covered in cysts. So I'm going to show you what my doctor showed me. This, I don't know if you can see it. Okay, so this is my ovary, and this is a normal ovary. So a normal ovary doesn't have anything on it, and mine is covered in little tiny cysts. However, they're not always so little and tiny, but this is the diagram that he showed me, something to this effect. So I was told that basically a ovary grows on the outside of my cyst, and it's very painful, and sometimes they can twist and rupture, and I would be on the couch screaming into a pillow, curled up in the fetal position. So it's not a delightful something. It's not nice to have. So he told me at that time that it was going to be extremely painful, and there's really nothing that I can do about it, and also that it causes infertility. Although you can still get pregnant on it, it's just a lot harder. So I knew by the time that I was 17 that it was going to be hard for me to be pregnant, which wasn't really a concern for me at that time. I was 17. However, I was with my fiance that I am now, so we've been together for 7 years. And now he is 28 and I'm 24, so we are thinking of family. Now, I have had issues for years, and September of 2011, I went to a new doctor. And when I went to the new doctor, no, I'm sorry, it was before September of 2011. It was probably in 2010. I went to a new doctor, and I had to get my my medical history. I had to get my medical history from my old doctor. So I did that, and I started going through my medical history, and I pulled out the 2 ultrasounds when I was 15 and 16, and from I was 15 and 16, and they both ultrasounds that I had showed polycystic appearing ovaries on both of my ovaries on both of the ultrasounds, and I was never told about it. So that's where I'm saying that you really need to make sure that you have a good doctor. No, I'm not saying that anybody else is going to have bad test results like that or answers to your test results, but I am saying that you do need to make sure that you trust your doctor if you're having problems like this, because it is a big deal. It really is, because I might be in the situation that I'm in if he told me about it when I was, yeah, just, you really need to make sure that you trust your doctor. Also, so I go to my new doctor, and I really don't want to use names on here, but we're going to call him Dr. Johnson, I guess. So I go see Dr. Johnson, and he is a male gynecologist, and I tell him about my issues that I'm having, and I give him my medical records. So I tell him that I'm having problems with pain again. So he wants to do another lap, and I'm sorry, that's what I'm going to call it because I can't pronounce it. I had 4 of them and can't remember the name of it, but does another lap, and when he opens me up on my right ovary or left ovary, I can't remember, I'm sorry, I don't have the paperwork in front of me. Either way, on one of my ovaries, I have a small grapefruit sized, which if you've seen a grapefruit, it isn't very small, but if you take a little smaller version of a grapefruit, then I have a grapefruit sized cyst on my ovary, and that's what was causing me so much pain. Well, while they were trying to remove it, it ruptured while I was in surgery, which isn't a big deal. I didn't feel anything. I was under surgery, but I can only thank whoever that ruptured while I was in surgery. I was, because I can't even imagine how much pain I would have been in otherwise. Anyways, so my left ovary began to start sticking to my bowel and my fallopian tube. So what the doctor did was, and I'm not sure if I said this or not, but this was in September of 2011. So keep that in mind, September of 2011. So he did was he separated the ovary the ovary from the bowel and fallopian tube, and he put basically some gauze around it. I'm not sure what the medical term is, but he put some gauze around it to keep it from sticking again. He also said that he seen some spots that looked like endometriosis, but it wasn't enough to diagnose me. So he wanted to keep a close eye on me for that. 6 months later, I started having excruciating pain. So they scheduled me for surgery within a week or so, calling them because so this was February of 2012. And I go into surgery, and basically from September 2011 to February 2012, which is 6 months, I went from basically not having any endometriosis, or I guess you could call it stage 1, to stage 4. It is very rapid moving, I guess is what you'd call it. Or anyways, so he also tried to my ovary was stuck again to my bowel and fallopian tube, and my right one has started to stick, which means that the adhesive bandage that he had put on the ovary before was no longer working, and he tried to separate the bowel, but it was not coming apart. Separate the ovary from the bowel and fallopian tube, but it was not coming apart. So he didn't want to take the risk of damaging the bowel. So he left it there, which is kind of painful, because if I move a way, I can feel the ovary on the fallopian tube, so it kind of feels like somebody's stretching something on the inside. But I would have rather him left it than damaging my bowel and me wearing a colostomy bag for the rest of my life, so I'm okay with that. And let's see, he did put an adhesive bandage on my right ovary, but there's really not much for the right one to stick to except for the side of the uterus, so as long as it doesn't adheres to the wall and not be an organ anymore, I don't know really how to explain it, then I'm okay. But now if you're talking about my left ovary and my bowel, fallopian tube, they're longer, and they're three together. It's not three pieces anymore, it's one. So we scheduled another surgery. I can't remember when it was, but we scheduled another one to take my left fallopian tube and ovary out. I was very scared, and I was very upset that I had to go through this. I was, 22, 23 years old, and I was losing my ovary and fallopian tube. I was devastated, and I cried and I cried and I cried, and I thought I was okay for a while, but then the day of the surgery came, and I freaked out. And my mom, she was very sad. I think she kind of blamed herself in a way, but obviously it's not her fault. It was very devastating to me. It was. I was highly upset, and I think I went through kind of a depression, I'd say. I kind of felt like it was taking away my womanhood. As silly as that sounds, it's true. Anyway, so he went in to do it, and he couldn't get it out. He wanted to split me open from right hip to left hip and pull it out. I would have to go. It was a very invasive surgery, and I'd have to be off work for over a month, and I'm not rich. I can't afford that. So, I talked about it with my mom, and we decided to hold off for a little bit. And when I say I talked about it with my mom and not my doctor, it's because my mom has always been for me, and I talked to her about it, why it was bothering me, and why I was scared, and she was kind of my advisor. And even though the doctor made it sound like it was life-threatening if I didn't get it removed, because he said that if the ovary separates from the bowel and rips the bowel, I could die from infection from the bowel leaking or even internal bleeding, which scared me. But I think we both, me and my mom decided second opinion. So, basically, me and my mom wanted a second opinion. We decided that my doctor didn't really give us a lot of options other than surgery, so we wanted to see what another doctor would say, especially because from my understanding of what the Dr. Johnson had told me was I was in a life-threatening situation. So we find another doctor, and this time I had decided to go with a female doctor because both of my last doctors were males, and I don't think that they understood where I was coming from. Dr. Johnson wanted me to have a hysterectomy. I was 21, 22 years old, and I was faced with having a hysterectomy or maybe not having a life at all. So we wanted to know if that was accurate. When faced with something this large of a decision, you really want to have a second opinion. So that's what we did. We found, like I said, a female doctor. We're going to call her Dr. Smith. It took a while to get in to see her. So I made the appointment, and we went and seen her. I believe it was either February or March of 2012. And she is great. I love her. But that is besides the point. I'm jumping ahead here. The appointment's in, paperwork, and I go in the back, and they take my blood pressure and my weight, and then the nurse takes me back to the room. Now the nurse sits there and asks you a couple questions, of course, and while we're talking to the nurse, she had asked me if I had tried Lupron for my endometriosis. I explained to her that I've never heard of that before, and that the only kind of medication that I have tried was metformin PCOS, which I don't know if anybody else has tried metformin or not, but metformin is, like I said, a medication for PCOS, but I could not take it because it made me extremely ill. It made me really nauseous, and I was going to the bathroom all the time. So I really couldn't get past that. A lot of people can. And she had only lacked the sickness did, and then she was fine. And then she was fine, but I just could not get past the sickness, so I had to stop using it. But back to the Lupron. It's called Lupron Depot. Lupron for short, of course. What that is, it's a 6-month shot. You can either take 1 shot every month or 2 shots every 3 months, and that is what I chose to do. But honestly, when the nurse had brought it up, I was a little upset, because for a nurse to say something like that, and a Dr. Johnson didn't even mention it to me whatsoever, it was a little upsetting, because all he wanted to do was surgery all the time, and he wanted to give me a hysterectomy, and he hadn't tried any kind of medications. So I was a little upset by that, but the doctor came in, and we had talked about it and tried to figure out what was the best course for me. So we decided that we were going to try the Lupron, but it was very expensive, so we had to go through a lot of paperwork and calling the insurance company. And after a couple mess-ups and problems that we had with the insurance companies, about 3 months later, we were able to start the shots. So my last shot was June of 2012, and it was a lot of help. The first 3 months was I was still in a lot of pain, but the last shot helped a lot, and that's what the doctor said it would do. So because I had went to her after my second shot, or right before my second shot, and I told her I was still in a lot of pain, and she said just give it some time. A lot of people, it takes the second shot for it to start helping. So that's supposed to help me be pain-free for 5 years. And the Lupron, what it does is it actually attacks the endometriosis, kind of like chemo for cancer. So we're kind of hoping that the fallopian tube will separate from the bowel. The ovary and the fallopian tube will separate from the bowel. It's not a guarantee, but we'll see. So anyways, after my shot, I had went back to the doctor, and this was 2 months ago now, and she told me that she really wanted me to wait to try and get pregnant for 2 months to make sure that the Lupron was out of my system, because it can cause birth defects. So she also wanted me to go see a fertility specialist, and I don't know if any of you have been to a fertility specialist, but it's really expensive. It's $197 for the first visit, and I don't know if any of you have been to a fertility specialist, but it's really expensive. It's $197 for the first visit, and that's just to sit down and talk to the doctor. So it's really expensive. But I went to, so I scheduled the fertility appointment 2 months out, so I could go see the doctor and then immediately start trying. And my appointment was last week. So I go into the doctor's appointment, and I was really nervous because I was scared that he was going to tell me that I wouldn't be able to get pregnant. And I go in, and I'm talking to the nurse, and she sits us in the office, and she takes my blood sugar, my blood pressure, and it was very high. It was 120/150, which is extremely high. So they told me that if I have problems with my blood pressure, then I really need to go see my doctor, because it can be dangerous for the baby and me if I get pregnant. So, but I don't have problems, and I did go see my doctor, and my blood pressure is fine. But they basically gave me 3 options, which the doctor told me that how severe my endometriosis is. He really wants me to just go straight to IVF. But I do have 2 other options, because I did some research myself, and there is a drug called Clomid, and it makes you ovulate. So we're going to try that probably first. But he really doesn't think that it's going to work. So I'm not sure where we're going to go from there. Now, he did give me the options, and he did fill the prescription. So we're just gonna start with that, and then possibly go to insemination afterwards. Okay, so IVF is very expensive. It's about $11,000 each time, and they recommend you do it 3 times, or of course if you get pregnant on the first, that's great. My other option was insemination. Now that is basically where they monitor when you ovulate, and they take the sperm and they inject it right into your fallopian tube, which he said would work maybe, but most people have a 12 to 14% chance of getting pregnant off insemination, but I have a 6 to 8%, because the damage to my uterus, even though the Lupron helped with the endometriosis, the damage is already done, and there's probably a lot of lesions. So he said we could try that, but he doesn't recommend it. He thinks that I should go straight to IVF, which of course, like I said, is extremely expensive, and I do not have $11,000 just sitting in my bank account. So although I did a little research on my own, and I asked him about by the way, insemination is $600 a round, and they recommend 3 rounds, or of course unless you get pregnant on 1 or 2. I took a drug called Clomid, and it makes you ovulate. So I wanted to try that. Now, he did say that he does not think that I could get pregnant by just timing. He said that he was going to allow me to try it, of course. And that's, of course, 3 months. And he says the normal statistics show that if it doesn't happen in 3 months, then it's not going to work. And which is why all of these are recommended 3-month treatment around your time, of course. Now, he gave me forms on each of them. I don't know if you'll be able to see it on here, but I'm going to attempt to show you them. This is the Clomid. This is where we're going to try and time our pregnancy options, I guess. And basically what this is let me show you this first. This is a medication, and this is another medication that he gave me. This is the one that I wanted to show you. This is progesterone, and it is a medication to actually help you start your period, because I haven't had a period since I started Lupron. It didn't come back after I went off of it. It eventually does, but your body has to get used to it. And I didn't have normal periods anyways before the Lupron, so I don't know when that's going to come back. So the doctor gave me the progesterone to start my period. And then basically it says on here to take 1 capsule by mouth each night for 10 nights to start period. I don't know if I actually have to take this for a full 10 nights, or if I'm supposed to start this and when I start my period, stop. So I do need to check with my doctor to see what I need to do with that. And then, now we're going to go to the sheet here. I don't know if you can see it really or not. Okay, this is just the regular. Of course, he wrote a note up here. He said, take the progesterone to start period. This is just the regular family planning, I guess. Day 1 is the day that you start your period. So, yeah, day 1 is the first day you start your period, so you can't start counting your cycle days. And by day 3, he wants me day 3, 4, 5, 6, and 7. So for 7 days, for 5 days, he wants me to take Clomid. Now this is Clomid, and the pharmacy gave it to me, and they put it in this big old bottle, but I promise they're not horse pills. It comes in little capsules like this. Can you see it? Yes, okay. They're just little round pills. Basically, those will make you ovulate. That's what the Clomid is for. It's to help you ovulate. So you're going to take those day 3, 4, 5, 6, and 7. So you might still be on your period, but I'm pretty sure that's normal. And then, of course, day 8, 9, 10, and 11 are from your period till the day that you ovulate. So, or the days in between when you stop your period and then the days that you ovulate, because you ovulate mid-cycle. So day 12, 14, 16, and 18. They recommend that you have sex those days, but they don't want you to do it every day because it needs to build up the sperm. So if you do it every other day, then they recommend you do it every other day because it builds the sperm up and you'll have more of a chance of getting pregnant that way. And then day 21, 22, 23, and 24, you need to go into the doctor's office and get blood work done so they can tell whether you were actually ovulating or not. They check your progesterone levels to make sure that you are ovulating. Then, about a week, maybe even 2 weeks later, you can take a home pregnancy test. And if you're pregnant, then it should show up pregnant. So that's what we're going to go with for the next 3 months. I'm hoping it's going to work. Just because, for one, I don't want to really go through a bunch of tests and stuff like that just to get pregnant. Now, if I have to, I will, of course. I know that a lot of people say that there's adoption, and we haven't totally ruled that out because we might try the insemination process, but definitely not the IVF because it's too expensive and there are a lot of kids that needs homes. So we haven't ruled it out, but we definitely want a child of our own. Then there's the insemination. Basically, you do pretty much the same thing that you do with the just regular family planning. You're going to start your period, and then you're going to take the Clomid day 3, 4, 5, 6, and 7. And then you need to call a couple of days before I don't know how many days it will take to get into your doctor's appointment, but it says to call a couple days to schedule a sonogram on either cycle day 10, 11, or 12. So you need to be able to see if they're going to do an ultrasound, and they're going to see if you're ovulating. So if you are ovulating, what they're going to do is they're going to take the sperm and they're going to inject it straight into the fallopian tube so that you can, the sperm can meet the egg. And then, of course, then there is the IVF. I'm not really going to go over that because it's not really an option for me. Basically, the IVF, they say it's 68% chance of getting pregnant. So if you have the money to do that, that's great, but I don't. So there's that. Also, me and my fiance, we know that I have the issues, but the doctor wants to go ahead and do a semen analysis on him because if he has a low sperm count, he said that there is pretty much no chance of us getting pregnant through regular family planning. So he said that we could try insemination, but he would recommend again to go straight to IVF, which I have already said is not an option for us. But they give you this little paper to look at. Basically, it just tells you how to collect the semen, and they give you a cup, and you can put your name on it and stuff like that. You can have two options. You can do it in the office, or you can do it at home. They do recommend that you do it in the office because it's more of a clean catch. We opted to do it at home, of course. He feels more comfortable doing it at home. So, obviously, you just need to he would just need to read the directions, and then he needs to bring it in to the doctor's office within an hour of doing it. You do have to set up an appointment. You can't just bring it in. So there's that. Now, he has an appointment tomorrow to go do that, so we will find that out. So I'm not going to start the progesterone until we find out his results, which will be tomorrow is Friday, so it could be Monday before I start it. I haven't really decided if I'm going to start it tomorrow or if we're going to wait until the results. But either way, I'm kind of anxious to start it, so I'll let you know how that goes. Yeah, I think that pretty much takes us up to speed. My doctor's appointment was last week. Oh, they also did blood work to make sure that all my hormones and my glucose and my thyroid and everything was okay. My white blood count was a little bit high, but I was recently sick, so they said that is what made it, but it wasn't something extremely high, so they're not too worried about it. Now, one more thing with the Clomid. They do suggest, or they do make you sign a release. However, my doctor did. I'm not sure if yours will. But they do make you sign a release stating that you understand that the Clomid makes you have more than one child. Pregnancies. Basically, it's just a release form stating that you understand that you have a greater chance of having twins or more. I think that something to 1 to 100 babies are twins, and then 1 to every 1,000 is triplets, but this doubles our chance basically. So when you're on the Clomid, I think it was 10 to every 100, and then 100 to every 1,000 for triplets, or something to that effect. I don't know if those are real statistics, so I was just going off memory. I thought it was on this piece of paper, but it's not. So that is where we're at. I think that I might go ahead and start the Clomid tomorrow, just because I'm really anxious about it. Even if the doctor says that his sperm count is low, I think we're going to go ahead and try to do the family planning still, even though he doesn't recommend it, because basically we feel those are statistics that he is going off of, so we still want to try just to make sure. So I don't know. I'm going to go ahead and start the Clomid tomorrow, and then I'm going to do every day how I feel, because if I get pregnant, I want to have it documented. So just so you can see what this is, the progesterone looks like. It looks like a little egg. So this is what is going to make me start my period. Yeah, so tomorrow he's going to go in for his doctor's appointment, and I am going to start my progesterone. And I know I said Clomid earlier. I meant progesterone, so I can start my period. And then again, like I said, day 1 is the day that I start my period, and then day 3, 4, 5, 6, and 7 is the day that I'm going to take 1 pill of Clomid. So that's what it's going to be, and I will go ahead and make a video every day